I knew that I had to take this in this package in a way where I can give it back to the world because everyone should have access to all the things. Even being, I was diagnosed at the age of 38 with triple negative breast cancer. And for someone who has spent so much of my career analyzing data in oncology, I was surprised to find out that as a Black woman, I was 40% more likely to die from breast cancer just because I was a Black woman. And so a lot of it had to do with the fact that we're diagnosed later. I found my own lump. I advocated for myself to get a mammogram, even though it wasn't recommended till I was 40. But if I would have waited till I was 40, I might not be here talking today. The data just like drove me to, hey, there's a bunch of different issues I see here that need to be tackled. And I can't tackle them all, obviously, but what can I do? So what I can do is I can build something to help other patients like myself track their data, be empowered to know this is your body and your treatment and this is your journey. So make it work for you and have the data and the insights to drive those decisions.
I'm just going to give that a little bit of space. That I so appreciate that. And there's this like really interesting comparison that I'm balancing in my brain where I've talked to so many like really consumer patient focused product leaders. And often what they talk about is like, we have to meet our patients where they're at. We need to talk with them in their own words. We need to meet them in the channels that they're at. And this journey that you're describing is their wildest dream because you're starting the innovation where you're at. Like it's in you're translating all of that healthcare information that you know where to find it, and you're bringing it in to your own spreadsheet,
Yes.
to your own organization, your own nodes. And that idea that like patient centered care doesn't have to like eventually make it there, but like the innovation can actually start like
Right.
with the patient. There's an elegance to being at the beginning of the problem. The patient is at the beginning of the problem rather than you have a tech solution. Often in
Right.
Silicon Valley, there's a tech solution and then you go searching
Exactly.
for the client.